But I would say that the relocation program of the Bureau of Indian Affairs was the largest migration of Indian people. Indian people at that time, and it was a very young generation of people, people in their early 20s, who had dreams of jobs, dreams of training, dreams of education, and moving to California. We had people, Oakland, San Francisco, and San Jose was 3 of 8 relocation centers throughout the United States. The Native American Health Center during that time was established in 1972. The organization and leadership at that time became aware that Indian people were not accessing the public health system here locally, or the healthcare delivery system. That was why the Native American Health Center was established, was because our Indian people were not accessing healthcare.
And after the Indians got kicked off Alcatraz, they set up the clinic in San Francisco, the Urban Indian Health Board. And they asked me if I would help them start a dental clinic. I wrote a grant, we got funded, and started a dental clinic in 1974, and I've been here ever since.
Well, actually, I took the job just for a very, my understanding was for a short period of time. At that time, the chairman of the board was Dr. Gerald Hill, a Klamath Indian, who asked me to step in when our previous director left the organization, and he approached me and asked me if I was willing to take on the job. And my understanding was that I would take the job for maybe 3 or 4 months until a permanent director would be found, and that's 20 years ago. This building was a remarkable turnaround, put a different mindset into the community. We were no longer renters, we were owners. We now were in the driver's seat. For too long we've been sitting in the back seat, waiting for others to tell us where to go, how to do things, what to do. We crawled over that back seat, jumped in the front seat, grabbed the steering wheel, and we took off.
This community needed a place where it was one-stop shopping. They could get their WIC, they could have their health care needs met, and they could see a counselor if they needed to.
It's like a meeting place when they come to the clinic. They know each other and they greet each other like they haven't seen each other in a long time.
It really is one of the only agencies as a kind of a focal point for the community.
For too long, healthcare has been about pulling people out of the river downstream. Our strategy was to go upstream, build a bridge, and prevent those people from falling into that stream. And that's the strength. It's not one individual that makes up the Native American Health Center. It's not a board of directors. It's not the executive director. It's all of us. We all have a responsibility to our community. We have to take on that responsibility, be very serious about it, because it is very serious. It's an honor.